Are you ready to unlock your full potential and maximize your productivity? Look no further than Productivity Smarts, the ultimate audio podcast hosted by renowned productivity expert Gerald J. Leonard. In every episode, Gerald shares captivating stories, invaluable tips, and cutting-edge strategies that will transform the way you approach productivity. Whether you're looking to reduce stress, overcome overwhelm, or simply get more done in less time, Productivity Smarts has got you covered. But that's not all. You'll also gain inspiration from real-life success stories of individuals who have achieved greatness through productivity. Plus, you'll learn the latest tools, techniques, and habits that will help you achieve a new level of happiness and fulfillment in your personal and professional life. So why wait? Join us every week as we delve into the exciting world of productivity and help you unleash your full potential. Get ready to take your productivity to the next level with Productivity Smarts. As a productivity expert and host of the Productivity Smarts podcast, Gerald J. Leonard has been a proud supporter of Kiva since 2011. Kiva is a non-profit organization that helps entrepreneurs in third world countries access the capital they need to start or grow their businesses. By making a small loan through Kiva, you can help these entrepreneurs achieve their dreams, support their families, and contribute to their local economies. And with a repayment rate of over 96%, your loan can be relent to another entrepreneur once it's repaid, creating a ripple effect of positive change. So if you're looking for a meaningful way to make a difference in the world, consider making a loan through Kiva. With loans as small as $25, anyone can be a microlender and help change lives. Visit kiva.org to learn more and start lending today.
All right, since 1986, Mr. Michael Vasquez has been the founder of industry transforming companies in the United States. He started his career as a software developer working at AT&T. In 1987, Mr. Vasquez founded a computer consulting firm where he wrote the software that automated Ladies' Home Journal magazine, which was previously being produced manually using typewriters. Now, in 1989, Mr. Vasquez founded ParamediC Systems, the first real-time processing system for hospital Medicare Part A claims. And in 2000, the Mayo Clinic Foundation purchased 5% of the company. And by 2004, ParamediC software was serving 1,500 hospitals across America. And in 2019, the Opioid Clinical Management, Inc. was founded in response to the dramatic opioid epidemic and the national need for a solution. OPCM has developed proprietary AI algorithms, patent pending, for 1,700 self-insured employers that use it today. Michael, how are you?
I'm doing well. Thanks for having me.
Thank you for joining. What an impressive background. You started off as a software developer, and let's talk about productivity. You started off as a software developer, and you grew yourself to starting a consulting firm back where you wrote software that replaced the typewriter. And then you went from that to creating ParamediC, where you attracted the Mayo Clinic, which is not a small feat, to invest in your business. And then you solved another problem by now finding out how to use AI algorithms that you have a patent pending on that is serving over 1,700 self-employed employers that they use today. What has made you so successful in your career?
I think really it's early on, even as in high school, I became very driven. And I think my parents and my wife probably says it was because I was a high school and college wrestler. I became very independent and relied a lot on myself, but it was also being inquisitive and trying to figure out why and how things work. So funny enough, during that entire career you just described, I loved tinkering. So I'd build a house or I'd convert an apartment just to get involved. And it was just not so much to accomplish it, but to learn how to do it. It's that drive to continue to learn that really, and my experiences during that journey, to bring me to kind of where we're at today. So I think that's one of the driving forces.
I find that to be when you are in a mindset of being very curious and a learner, that the financial resources take care of themselves. And I believe that that's why you have continually developed other companies and have continually grown yourself, because you're so interested in learning and developing, which is part of the human spirit.
Right. Absolutely.
Excellent. So what do you think is poorly understood about the way you started businesses? And also, I know, your book is about the opioid crisis. What do you think is poorly understood about these areas?
Really, I think it was the underlying impact almost in every company that I've started to actually the individuals, which always touched an organization.
Right.
And through that organization either suffered or succeeded based on the ability for me to participate and to be part of that organization. So a key thing I've found recently over the last several years is communication is so key. Without being able to communicate as you have a vision, a desire to build something, it's very hard. You can't be productive because
Right.
you're spending so much time closing the loop on thoughts. Where if you communicate regularly, you can then get the entire group to be productive going forward, as
Right.
opposed to by not communicating, you're spending most of your time trying to explain. If I'm explaining, I'm not productive. And
Right.
so that's really the heart of what I've found as over the years as I've started companies, is that's probably one of the key underlying early in my career things that I didn't do very well
Yep.
to now later in my career that I've focused on as a key piece to success, because without being able to communicate and be productive in our own organization, we can't help our clients be productive.
Correct. Correct. Now, tell me your story. How did your childhood and growing up, were you always this way as someone who was really curious, someone who was a learner? How did you develop that gene, or how did you turn on that gene, if you will, that you have there?
I was always I think I was an only child. And so until I was 18. And I think that's really part of it, is I had to learn on my own. So I was always doing something, building models, developing new formulas for Miracle Grow. My parents used to sit in awe of how I could get a plant to grow because I was tinkering with the formula for Miracle Grow. So those are the things that sort of started to drive that my inquisitive sort of sense. And then I think when I got into an individual sport just drives you to push yourself to your limits, learning what my limits were and trying to push through those. And I think I brought that same mindset to business. And I think that's really where it started.
Okay. Now, you said something there. You just kind of quickly glanced over it. You said you were tinkering with the formula. You were tinkering with the formula for Miracle Grow. Can you double click on that and tell us more? How did you tinker with the formula for Miracle Grow?
Well, things like Miracle Grow, keep in mind, I was young when I was doing that, but my grandmother, who actually was involved at the time, was trying to grow tomatoes, and
Okay.
she did a great job. But I found if I added other elements to the Miracle Grow, things that are just in the kitchen off the shelf, I could actually enhance acidity, pH levels. And by doing that in conjunction with Miracle Grow, I could grow the best plants there were and just put her in awe. And I don't know that I really knew the chemistry behind it, as the idea that, boy, this sounds like this could help. And so obviously at 8 or 9 years old, you're not thinking a whole lot about that. But that's really started the inquisitive side of, you know what, I could really figure, if I put my mind to it, I could probably figure almost anything out.
Right, right. That's basically, as you can see from my background, I'm a musician, and I talk about that in all my books. That's how music starts, right? You don't start studying music and learn the theory right off. What you do, especially for like the Suzuki method, or just if you're learning on your own, you learn how to play a song and you figure out what works, what doesn't work. You listen to other artists and you incorporate that. And then later on in life, or later on as you're trying to really understand what is it that you're doing that's actually working, you then begin to study the theory. So it sounds like it was right up your alley from the standpoint of the way, natural learning.
Yeah.
It's just to experiment and try things and go, you know what, I'm seeing this, I'm seeing that. I think this may work. Let me give that a try. Right.
It's interesting. Yeah. It hasn't changed. So I'll be 70, and it's today still, I just started, I was part of the management team that just started a new drug company.
Oh,
And
wow.
it was interesting that the FDA, when they came to us, we know the drug works because it's been in pilot for 10 years. So we know the drug works. But interestingly enough, the FDA's question they came back and they said, we don't care if it works. Tell us why it works. What protein are you activating? What amino acid are you activating? And I went back to the beginning, being 8 years old, and it's kind of like wondering, okay, why does it work? And so even though I didn't have the answer then, even today at this stage, I'm still looking for that answer.
Gotcha. Now, I want to get into your book. And your book is not always a topic that I'll talk about on this show, but I thought when you and I met, I thought, this is a really important topic, right? And it's about the opioid crisis in American healthcare. But what attracted me to this topic for Productivity Smarts community is your identifying a solution through leveraging AI. And as you go through the book, you talk about the impact on the American economy and its productivity and society. And so that really attracted me to want to have a deeper conversation with you about your book. So let me ask you this question. How does the opioid crisis, as you detail it in your book, intersect with productivity in American healthcare, and how might an AI solution that you discuss help with that regards?
It's interesting because as you look at this, the productivity doesn't touch in the beginning, but what we found is you've seen in the book, we operated an opioid treatment center. My oldest son he and his best friend got involved in opioids right after one of my companies sold, and his best friend passed away. So we decided that we'd get involved and help. And as we did that for 13 years, every day, seeing people walk in to the opioid center and they had lost hope in their eyes, you could tell that they had lost all hope. And obviously, but these weren't people off the street. These are people who had financial means and who would also tell us stories about their employer was sending them here because of the fact that they weren't productive, but they wanted them back. So there was value to that employee, but the employee just couldn't perform because the opioid was impacting their life because it was really the piece that was driving them. And they wanted to get back to where they were, to that productive person that they were both in their family, in the community, and then obviously to their employer. So interestingly enough, if a patient, a person on your staff, a friend or family member is on opioids, they're 2 times more likely to call in sick.
Yep.
They're 3 times more likely to be late to work, and they're 5 times more likely to file a work comp claim. So what I realized then all of a sudden was that members or patients coming to us with an opioid issue were really an employer's issue. And by understanding that, we could understand then as we drill down, and people aren't aware of this, 75% of the people in the United States who enter an opioid treatment program actually report they started with a prescription written by their doctor. So now all of a sudden it closed the loop that instead of me being a non-productive person inside the company, but the company's health plan actually got me on the path to that journey using and overusing opioids. So it was interesting as I looked at that. So when we built the company, the first place we decided to look was the company's health plan, not at the person. So for example, by looking at that productivity impact and the impact to the employer, we have a client in Central Florida that has 12,000 union members.
Okay.
We've been installed there 3 years now. We've reduced opioid overuse 70%. And the employees, the union members, still don't know we're installed. We've never talked to a member, to a patient, because the AI software allows us to spider through claims and not only find the patient and how they're responding to an opioid, but find the doctor who's writing that prescription. And we scrape the doctor's name out of the claim and then actually build a roadmap of the location and performance based on these patient outcomes that allows us to give us a work list. And then our staff pharmacists reach out to those physicians to help them educate on how they can practice prescribing opioids better, being more productive, because they want better outcomes, and yet still at the same time, not have to change how they practice medicine, because you'll never get a doctor to change how they practice medicine. So by using AI, we can get a work list of doctors who we can go out and ask them to change how they document how they're practicing medicine. And that's how we've been able to get all our results.
Wow. Now, can you go into, because I understand it because I have an IT background, but can you talk a little bit about how you're using AI in that environment? Because it sounds like you got a lot of data that's coming in. And obviously with AI, it requires a lot of data to feed what's called a neural network. And
Right.
you're basically teaching the system. But can you explain that and how you're doing that?
And from what you just described, it's actually the very first company I took public on NASDAQ in 1995 had integrated neural networks. And so we used the learning to help get a patient from admission to discharge.
Right.
In this case, we're using it differently because as we look at the data, we're trying to predict, because as I've already mentioned, we really are looking for the doctors who are allowing this opioid overuse to happen to the patient.
Right.
However, you're never going to get a doctor to change how they practice. So the software predicts based on patient outcomes and their conformance to CDC guidelines, which the software can tell how conforming you are. It predicts your potential to accept or embrace the solutions that we're going to come to you with. So a doctor that might be a surgeon and it shows that the outcomes are the same across the board, we probably aren't going to get them to respond to the outreach that we're going to do to ask them to change how they practice. However, the software can then rank you, and then it ranks where you're at in comparison to the rest of the providers in the network who write prescriptions to all the union members, for example, in your union. And then it allows us to predict. And so it allows us to, with very few pharmacists, be very effective and productive because the software does all the heavy lifting. And then the pharmacists there's still a human piece to it because doctors just aren't going to deal with a computer.
Right.
But you couldn't be as productive as we are without the software parsing it out and predicting where should I go? Where's the target rich environment I can go and be successful? And success does means that a doctor will change how they prescribe opioids so that the patient has a better outcome and opioids don't affect their life negatively ongoing.
Exactly. So it sounds like you're using the mindset, and help me understand this. It sounds like you're using the mindset that Microsoft has used when it worked with OpenAI or ChatGPT, and they added it to the Microsoft platform and they called it Copilot, because basically the mindset there is that an AI tool is now an assistant. It's not taking over the work. It's not doing the work, but it's assisting me in getting information that would be very, very difficult for me as a human being to go and traverse through all that data. But now I'm having this AI tool go and do all the heavy lifting, handing me the solutions, the processes, the nomenclature, the framework in which I talk to the doctors or the healthcare administrators about and the patients about, so that as a representative goes and meet human to human, I'm better equipped with more evidentiary information to provide that. Am I on the right track there?
Yeah, no, absolutely. Let me give you an example. So it's actually in several states, it's a law, but in most states, it's just a guidance from a medical association that if you're going to prescribe opioids, I should have an opioid contract in the patient file. That contract explains the risks of continuing opioid usage. Right. Under what guidelines will I agree to refill your prescription? And under what guidelines won't I agree to refill your prescription?
Right.
Now, when we call the very first time, we don't just ask a blind question. The software's already told us it's 95% impossible that you're using opioid contracts. We already know that when we ask you the question, we know the answer.
Gotcha.
So it's almost like a lawyer wanting to know the answer, but we know it. And that's why we have such a high success rate of physicians embracing what we bring to them, because the software's already parsed out the fact that we know you wouldn't be getting the patient outcomes you're getting if you were doing patient contracts, because you may not be aware of this, but there is no research in the United States that supports a family practice general practitioner prescribing an opioid for more than 90 days. So at day 91, I should be referring you to somebody else. Well, family practice doctors don't want to do that, so because they want to keep the patient, and so they continue to prescribe with no training. And so by identifying that and allowing them to start to put these tools to let them take care of the patients, they're able to get better outcomes and still care for the patient. But the software allows us to help them and not call, instead of 5,000 doctors, we can call the key 300 that are really creating the issue.
Right. And what response are you getting from the employers and their HR folks that you're having to engage with as you implement these strategies?
Yeah, the employers have really, it's quite frankly, it's financial, because we not only have an impact, but you may not be aware, opioid people who utilize or given an opioid prescription use the healthcare system 3 times more than a person not on an opioid prescription. So what happens is, when you can get somebody to discontinue that opioid, they become very productive at work,
Right.
but they also save that employer millions of dollars. So our average client saves $1 to $2 million, regardless of the fact that the social benefit they're bringing to their employees and their
Right.
families. So it's, the employers are getting sort of a double win. They're getting a productive employee back, and they're saving money doing it.
Right. Now, I noticed something in your book. It's interesting because you have a couple of things that are really related to the project management space or agile space or productivity space, if you will. And one of your chapters talks about a retrospective review. And then you had another one that says, the challenge of getting doctors to change and a paradigm shift. And I was looking at those words going, this is like project management language or agile management language, especially for anyone who's a productivity focused person and does it professionally in business, not just in trying to be productive and getting goal setting. But when you think about like your retrospective review, how do you leverage a retrospective, which is a review of like an after action review of a scenario? How do you leverage that in your practice?
Well, what we found was, because of HIPAA, which are the privacy laws in the US, it was very difficult to get anybody to agree to give us patient names.
Right.
And as I said earlier in the beginning, that 75% of the people coming into opioid treatment started with a physician. We decided that probably the physicians are where we should look for the heart of the problem.
Right.
However, if there's 5,000 physicians out there, number one, you can't afford to call all 5,000. And number two, a small percentage of those 5,000 are really the heart of the issue. So what we did then is we took the retrospective view of the past year, and we looked at patient outcomes, and the software spiders through looking for poor patient outcomes. And those are all defined in the book also.
Right.
And those poor patient outcomes allowed us to identify the doctors that we needed to scrape out and create a work list. So we used a retrospective view of patient outcomes to provide a prospective view of how doctors are writing prescriptions today. And by using that, we could identify the doctors that really needed to have those enhancements. And quite frankly, they view it even as a productivity benefit, because of the fact that you don't have patients coming back several times dealing with opioids and dealing with the complexity that an opioid brings to your practice. You're dealing with an issue, an illness, a surgery, and all of a sudden I've got to deal with this patient who's also got an opioid complex issue, and it's distracting and obviously unproductive.
Exactly. So one of the things that, again, you talk about is getting doctors to change. And we know that when it comes to any type of goal setting, anything around productivity, anything around transforming your life, one of the biggest challenges we all have, not just doctors, but that we all have, is making that change. And consciously, we can be aware of the fact that we want to change. But then we get internal resistance when there's parts of us that are stuck in an old paradigm, and yet we know where we should be going, but it's hard to kind of get ourselves going that direction. What were some of the things that you've learned, and also some of the strategies that you use to help doctors to make that change?
It comes from the school of cognitive behavior therapy. And so we really based it in that. So your thoughts really become your beliefs.
Yep.
And your beliefs really start to create your actions, and your actions create your habits, and your habits create your character. So
Yep.
a good example of how that works in real life inside of an opioid treatment center is we have somebody not in a discussion like we're having, but over weeks confirmed us what you really think the best version of yourself is. And I want to always be a fireman. So when I leave here, I'm going to go be a fireman. But in the last week, you bring up this discussion that I think it's okay. I'm here for heroin or opioids, but I'm going to smoke pot when I leave. I'm probably okay doing that. And then my response is, well, if you think it's okay to smoke pot, how are you going to pass the entrance exam to be a fireman? And all of a sudden they sit back and they go, I never thought of that. Maybe I better not smoke pot. So I've just changed their thinking about pot.
Right.
And then they change their actions and their beliefs and they move on. So what we did was we picked that scenario up and we put it inside of a doctor's office. And so we showed the doctor that that's how the patients are going to change, is if you put these thought-provoking periods in your discussion with them, you'll get them to pause and decide if they should use opioids or not. So for example, all the discontinuance I've talked about opioids, not one person's ever been denied an opioid prescription. 100% of the discontinuance has been a unilateral decision by the patient because the physician has put a brief intervention in front of the patient to make a decision, should I continue this or not?
Right.
So that's kind of how we get doctors to use it, is taking what we learned in the opioid detox center in cognitive therapy and showed them how they could implement that inside their practice. And all of a sudden, we had amazing change.
Right. Because you got them to begin to address their limiting beliefs and some of their non-conscious beliefs about their actions, right?
Right.
About their actions. And once they realize that my actions and habits are not aligned to where I really want to go, and if I really want this in my life, to be a fireman, to be a doctor, or to go into another profession, to be an accountant or a software developer or a musician or whatever that case is, then they have to address and really take a look at. And that's one of the things that I've learned as I've worked on myself to accomplish my goals, was that I needed to look at any negative beliefs or limiting beliefs that I had about my own capabilities and decide to address them. Would you say that that would be something that those doctors are doing with the patients? And what about the employers as they were dealing with their workers? Is that the same kind of conversations they're having?
It actually is, but it's subtle because you're not having the conversation.
Okay.
It's actually, we took cognitive therapy behavior to an action point as opposed to a discussion.
Okay.
Because if the physician felt like they had to verbalize it, they just don't have time to do that.
Gotcha.
And so we could accomplish cognitive therapy outcomes by putting brief steps in the process. So for example,
Okay.
if you walked into my office today and you want me to refill your opioid script, but I tell you that you need to do a drug screen to do that, fully supported by the CDC. I've never asked you before, but today I'm going to.
Right.
50% of people will not refill their opioid script, and they'll discontinue the opioid that day at that moment. 50% of the people that come back next month will discontinue. And so that what we do, or we put 10 of those brief interventions in front of the patient by showing the physicians that you don't have to learn to be a cognitive therapist, but put these brief interventions in front of the patient so they'll reconsider and make the decision for you.
Right. You give them almost like a hard choice.
Yeah.
That's very introspective, that they have to look at themselves in the mirror and go, wow, do I really want to put myself out there like that? And do I want to have to take that type of exam or so on? And then they begin to really, question their activity, which changes their beliefs and their mindset.
Yeah.
The book that you've written, The Untold Story of the Opioid Crisis in American Healthcare and the New Era of Prevention Through AI, I thought is a really smart work, a really great book. I love the fact that you have, was it Governor Tommy Thompson who endorsed it? You also had a judge. I don't remember the judge's name now, but
the White House, he was actually the White House drug czar.
Yes,
did the forward to the book.
Exactly.
Yeah. I've had great support from a lot of, so both Tommy Thompson was Secretary of Health and Human Services, Udom Dillon was the director of the DEA, and Patrick Kennedy was the author of the healthcare parity law, behavioral health. So I've had great support from people as they get the idea, and I've interacted with them. They can see that this could be a transformative project. And obviously everybody's trying to solve the opioid crisis.
Yes.
And I think you have to get to the heart of where it's at. And without the AI tools, we couldn't get to the people where I think the heart of it is, which is the physician.
Right.
And if 75% of people are starting there, I need to be pretty smart when I go to that physician. And without the AI tools, we couldn't be productive at all.
Exactly. It's an amazing use of new technology, and it's an amazing example of how to embrace, not to be afraid of technology, but to embrace the technology that can propel you to new levels of intervention and communication and interaction with those that you would not be able to if you weren't able to embrace that. So, Michael, where can people learn about you and learn more about you and also get a copy of your book?
I have an author website that's just my name. So it's www.michael, Michael, dash, and it's Vasquez, V as in Victor, ASQUEZ.com. And that'll get you information on my background and links. And then obviously LinkedIn, just under my name, will get a lot of background also.
Excellent. And obviously they can find the book on Amazon and other all over where books are sold. Michael, I really want to thank you for what an engaging conversation. I know from reading your book and having this conversation, I've learned a ton, not just about the opioid crisis, which we all know it's a really big challenge, but a really smart way of using technology and embracing, the technology and not being afraid of it. Because I think, especially during this time when things are moving so fast, many people can become afraid of all the change. But if you're not afraid and you put your toe in the water and you step forward, you can take your thinking, your life, your outcomes to a whole new level by embracing that. And I really appreciate you setting an example in your book and with your life of how you've used technology to do that.
I appreciate it, Gerald. Thank you.
You're welcome. If you're enjoying the content and finding it valuable, we would appreciate it if you could take a moment and leave us a review. Your feedback is important to us and helps us reach a wider audience. If you leave us a 5-star review, it would mean the world to us. Not only does it help us improve the podcast, but it also helps us attract more sponsors and grow our community. Thank you again for your support and for listening to the Productivity Smarts podcast.
Thank you for tuning in to Productivity Smarts, where we help you achieve your goals and live your best life. We hope you've gained valuable insights and actionable strategies to boost your productivity and increase your happiness and fulfillment. Remember to apply what you've learned and keep striving towards your goals. And if you haven't already, be sure to subscribe to our podcast for more inspiring episodes and expert advice from our host, Gerald J. Leonard. Until next time, keep pushing forward and unleashing your productivity smarts.